Hi. Hello. How are you doing out there? To the Empowering New Nurses show. I'm Dr. Miriam Smith. I just want to welcome you. Hope you're doing well. Hope you had a good weekend. Just about to face a new week. Let me hope that you're ready, prepared, ready for work. Now, I just hopped off two different Zoom meetings. One of them was talking about many testimonies, many testimonies on both. But I'm going to zero in right now on the one survivors, breast cancer survivors. I heard some testimonies that were so passionate, so deep, so emotional, because there are many women out there who have gone through a lot. And I'm just going to zero in on resilience and strength. I don't know if you have had family or friends or anyone that you know who have experienced, um, who have had that diagnosis, breast cancer. You know, as we celebrate Breast Cancer Awareness Month, many lights have been shone on the fact that early detection saves life. Once you have some abnormal, that gut feeling of some abnormal, say, in your breast, there is a point where don't take it for granted. Seek attention immediately. It's best you try, and it's not anything uh, disease wise or so, rather than you've taken it for granted and you could have had treatment earlier. So that's important. But I'm talking from this perspective of someone, my sister, one of my sisters had it. And it's can be very frightening. It can be painful at times. It can be testing at times. But I just want to remind you that there is community support. I don't know what you as a survivor or the other person might be going through, or just a caregiver or a friend. And you know, we have so many components we are made up of. That's spiritual, that emotional, that physical, that social, emotional part of us. And of course, the spiritual. And as I hopped off this line, as I told you, the Zoom call, and I heard different women giving their testimonies, they relied a lot on community support. Apart from my sister, I had a very good friend, a nurse too, who passed. And it was some emotional times for me. My sister, again, well, she passed, but my sister is a survivor for more than 15 years, of which we are so ever grateful. And I know there are individuals out there right now who are survivors. There are many who are survivors at this time. Some might be discouraged. Some might be challenged. Some might be going through their treatments right now, and it can be difficult. Just think sometimes, as I heard some of the testimonials, the hair falling, their appearances have changed, and the list goes on and on. But I'm here to encourage somebody. Just remember you're not alone. There are many large communities out there who are there. They are dedicated themselves to help and to support. For example, in my church, we have prayers. We pray for one another. Those who are able to physically assist uh, and support individuals going for their treatment, maybe helping them to do a little self care after the treatment. And that's important to take care. You might have to go to go to a restaurant, go to a spa, or go in somewhere that helps to relieve or alleviate some of the mental agony. Yes, it is important to be supportive to each other. It's interesting to know also that there's hope for the future. We have individuals out there who are researching, they're researching tirelessly to get the cure for that disease. And many treatment plans have been placed whereby individuals have gotten treatment that have been researched. Some they might call them trials, but they have been successful. My sister, for example, had stage 4. It appeared as if there was some metastasis. She had reconstruction surgery, and she has done very well. Thanks to medicine and the advancement, we have had individuals who never made it. They tried, but they never made it. So the innovation, the research and innovation, they're real. And the treatments. So we should also pray and thank medicine for their effort and their passion in continuing to find the cure for cancer. Many individuals, to support this, they have gone on walks. They have given talks. This week I was at community outreach, and interestingly, there was one of the stations that had a breast cancer stride, and they plan in going out in stride. There are other organizations also, apart from large institutions that are involved. There are many ones. Their friends who are going on walk for their friends or their family or their institution. But there are various ones out there. So if you can be a friend or one of those who can support, because at this time, the mental state, the depression, those individuals, those survivors, they need that support. There might be mothers with their young children, and as a community, you can step in, of course, with permission, and be supportive. Now, I want to tell survivors that whenever they have accomplished something, if there's a milestone accomplished, they should celebrate. And the support groups should be there to help to celebrate. Have accomplished the treatment modalities, it's important to celebrate. Seeing the recovery of, say, for example, the skin that can sometimes be changed, and seeing it, a restoration in that, that's all reasons that you should give and celebrate and be happy about that. Each day, each month, week, each month, and year, honor your progress as you go along this journey. This journey can be challenging. I don't know if I'm speaking to any of you as a survivor, but I know for sure that it can definitely be challenging. But there's hope because we have been progressive. Medicine has been advancing. treatment modalities have been increasing. So you got to be strong, you have to be resilient, and the survival rates are increasing. And we have to say kudos to all those who have been in the process, who have been working diligently, tirelessly to make this happen. Breast cancer awareness and survival rates. And survival rates are increasing. And I repeat that because there were those days or the time when one thinks that once you have cancer, that's it. But today, we can say thanks to medicine because we have come very long, a long way. So I would just like to say to you all, friends and family and supporters, to keeping on and make the world a better place. So as I leave tonight, if you have a comment to make, it's okay. I would like you to. I would like you to comment on my YouTube channel. I would like you also to subscribe. Subscribe. Leave a helpful comment. If you have a topic you would like us to talk about, I encourage you to. Now, I do have with me, okay, okay. I have with me here my book, Nurse, The Guide to Empowering New Nurses in the Delivery of High Quality Care to All Patients. And as one of my friends said, you got to keep saying it. So I'm saying it again tonight. And you'll be hearing me talking about it because it has information in there for my young nurses, my seasoned nurses, my nurses who are transitioning from one area to another. Information in here on communication, information in here on different areas of fears that young nurses or nurses experience. I've gleaned a lot of information over my years of working in different countries, and I've retired recently. And I've put it together for your benefit, the patient's benefit, and for everyone to be aware of some of the challenges and, of course, the rewards that many nurses have had and what I have had. And I'm putting together in this a booklet, short. It's also to benefit and to help you on your journey, your nursing journey. You can also, as a person on the outside who is not a medical person, read, or the interprofessional team, because there are tidbits, there are pearls that you can embrace and you can learn from. And patients too. Some of the expectations, they are there. They can read for themselves and see that nursing is such a noble profession, rewarding yet challenging. But when the nurse gets that inner satisfaction and the patients receive that satisfaction and they combine or they collaborate and make, because of course the patient is a part of the plan, the patient participates in his or her care. That's important. And I will not leave without saying culturally congruent care. You know, I've taught transcultural nursing for a while, community health. Yes, those are the areas that I've focused on while I was in academia. At the bedside, clinically, I care for a diverse group of patients, different areas of nursing. from critical care, ophthalmology, education, med-surg, name them, name it. I've been there. Community health, yes. And I will not forget my response, 9/11. I was there. So all those traumatic, dramatic scenes, I was a part of. I've put some of that in this book. So you don't have to be a nurse to read it. You can check the ratings on Amazon. It's an Amazon bestseller. And this is international. It's in the library. It's also in nursing school. And although you might not be a nurse, but non-nurse individuals have read and have given their pointers what they have read. They have given their pointers on Amazon. So you can check that out. We have ebooks and we also have paperback. So get your copy and read for yourself what the life of a nurse can be at times. The fears, the communication, and more. And the experiences. The quizzes are there also. The suggestions are there. Coping mechanisms that you can use on a daily basis. Some whys, some what, whatnot, and more. Be blessed. Have a good week as you go forward. Remember, it was Thomas Edison who said, if you had used I'm paraphrasing, the capabilities that you have within you, you would literally astound yourself. So you have the potential. And there's somebody who wants to hear your story. So I encourage you to share. Just share. It might be your time to start thinking about your book. Yeah. So have a great one. Great sharing with you. Remember as you go, early detection saves lives. We celebrate Breast Cancer Awareness Month, October. Bye.